Expect a showdown in the VA health scandal today on Capitol Hill. A House committee will question the department's acting inspector general about a report on dozens of patient deaths at the Phoenix Veterans Hospital. Wyatt Andrews is in Washington, where a critic says top VA officials interfered with the investigation. Wyatt, good morning.
Good morning. Later today, Congress will investigate the investigators, asking why the Inspector General found no link between the secret wait list the VA kept in Phoenix and the deaths of up to 40 veterans. We spoke to a top-level VA whistleblower who told us that conclusion was a last-minute change made under pressure. The issue surrounds the investigation of whether more than 40 veterans at the Phoenix VA died while waiting to see the doctor. The Inspector General's final report in August concluded that it could not conclusively assert that long wait times caused the deaths of these veterans. But the line downplayed any connection between patient deaths and delays in care, and according to this whistleblower, it was not in the original draft of the report. They said that the wait times didn't cause the deaths.
Correct.
And that was added?
Yes.
At the last minute, essentially.
Yes, it was.
Our source, who works at VA headquarters and who spoke exclusively to CBS News, says officials inside the agency asked for a revision of the first draft. That's standard practice, but in this case, the source says it amounted to pressure on the Inspector General, Richard Griffin, to add that line to water down the report.
The organization was worried that the report was going to damn the organization, and therefore it was important for them to introduce language that softened that blow.
The Office of Inspector General issued a statement calling our whistleblower wrong, saying, quote, "There was no pressure from the VA to add this line." The statement adds, "We did not find sufficient evidence that any delay resulted in death." But the conclusion that no deaths were caused by delays seemed to conflict with the rest of the report. For example, 28 instances of clinically significant delays were found, including 6 deaths. And some of the findings indicated that either treatment or an appointment for this patient might have changed the outcome.
He was a good guy, you know.
The Inspector General's finding was also a surprise to some of the families who lost a relative. Teddy Barnes says his father Thomas, a Navy veteran, died while on a secret wait list, but no one from the Inspector General's office ever called his family.
It sounds like they're either trying to cover it up or sugarcoat it a little bit, because we didn't hear anything about this.
And now, newly released figures show that 293 veterans died, not 40, 293, while on those secret wait lists. That does not mean the veterans died from lack of care, but some House members are already asking if the Phoenix investigation should be reopened. Gail?
Wow, a lot of questions there.
That's a much bigger number. Yeah, much bigger number.